Good afternoon. We're here with you just after the noon hour for The Doc is In. Ask Dr. Arwady. I'm Sybil Madison, your Deputy Mayor for Education and Human Services, and I'm here with Dr. Allison Arwady.
Good afternoon.
She's your Commissioner for the Chicago Department of Public Health. This is where you can get all of your questions answered and the latest information on COVID and vaccine. We're very happy to be here with you. You can put those questions in the box below. You can also use the hashtag AskDrArwady and send those to us through Facebook or Twitter. We're going to check our distance.
Looks good.
This is not a thing of the past, nor are your masks. And get right to the latest.
Sounds good. I'm sure there's a lot to talk about. So as always, chicago.gov/coronavirus is your one-stop shop for everything related to COVID here in Chicago. And if we go to the dashboard, you will see that the news on cases and positivity and our outbreak continues to worsen. You'll see our positivity rate is at 3.4%. Now, objectively, a 3.4% positivity is still good. It is in the lower risk category, but considering it was 2.7% less than 2 weeks ago, and we've been seeing it ticking up, is a concern, particularly because the testing is really pretty flat. We're doing 12,261 tests per day. That's just up 3% from a week ago. So change in positivity not being reflected by, it's not a drop in testing, it's a true increase in cases. And if we look at the cases, we are now averaging 365 every day here. That's the 7-day rolling average. And a week.
And we have been cheerleading Chicago to get to under the 200.
To get under the 200, exactly. Our goal, to get to that lower risk, and we didn't make that number up. That's that's Chicago's population and rounding for the levels that are accepted for being lower risk. And not only did we not get under 200, we came back over 300, and now we are sneaking toward 400. And 400 is a problem. 400 is where we move, even from a numbers perspective, into a high-risk territory. 400 cases a day for Chicago is the equivalent of 15 cases per 100,000 per day, or our travel order in terms of the level of concern. And it really marks poorly controlled COVID. But the other thing of concern is that our epidemiologists have been looking at these and other metrics, and they look at not just what the number is, but what is the rate of increase. And we've seen really substantial increases, more than 15%, each day, looking at the week before, and so we're in high-risk territory already from a case perspective, and certainly, concerns about that. The vaccination efforts continue to go well. We can answer questions about that. We're getting close to 1 in 4 Chicagoans having gotten at least that first dose. And if you limit it to just people 18 plus, we're close to 1 in 3. We've got more than 1 in 2, finally, of those over 65. But
do you think that vaccine news is leading to people not being as careful?
I think some of it is. People are feeling, there's a lot of good news, and spring is here, and
I know the weather,
and people wanting to gather, and we are really, maybe we'll take one more quick look at the data here, just to look at the demographics, because I want to highlight really the main issue that we're seeing here. I'm going to show you how we do this. We just switch and we say we want to look at age, and if we just look in the last, let's say, month, and blow this up so people can see it. See this red line on top here? That's the 18 to 29-year-olds. And very much, although we're seeing increases, the red line is the 18 to 29-year-olds, the light blue is the 30 to 39-year-olds, the yellow is the 40 to 49-year-olds. You can see it's really those younger adults where we're seeing this significant increase. People may have questions about that. Obviously, we worry most if we see cases going up in older folks, but the worry is that these increases, if the people are in touch with those who are older and have underlying conditions, will we see this result in hospitalizations? The problem is in Michigan, especially, they really have. Hospitalizations are up more than 50%. In those in their 40s, they're up hundreds, 800% I saw. And so,
did Michigan have the same pattern of the younger ages
Yeah.
being the ones driving the case rate going
They
up?
did.
Oh, okay.
They did. So anyway, so definitely some concern there, and I think we can come off the dashboard and maybe before we get into the details, I did want to share a little bit of information just about reopening in that context. I know there's a press release and there's some more information coming out. Obviously, we are all wanting to be moving ahead with reopening as it is safe. Right now, with these numbers, this week is not the time to be expanding capacity, particularly in indoor settings. But we are making some moves in outdoor settings, recognizing that in outdoor settings where where the ventilation is naturally very good, as long as people are doing the masking and doing the social distancing. And so some good news on the outdoor front. For bars and restaurants, for example, we're going to open up the maximum outdoor table size for up to 10 people, but the tables still need to be 6 feet apart, but like more opportunity for outdoor dining. And you might have seen the al fresco. We're really trying to push a lot of this outdoor dining, which when the weather's good in Chicago is really a good thing for other reasons. There's also some increase in the outdoor capacity for social events like weddings and potlucks. So the total outdoor capacity is increasing to the lesser 50% or 100 people if you're meeting in an outdoor space. And seated spectator events, outdoor venues can go that have capacity greater or equal to 200 can operate at 25% capacity. There's some more details that you'll be able to find on our website, specifically calling out places of worship, which I know as we're coming in to Holy Week for the Christian faith and other important religious holidays. I know Passover is more of a home holiday, but regardless, there is no capacity limit on outdoor gatherings for places of worship as long as you're keeping that 6 foot of social distancing. But there are still limits in place for the indoor, and that's just because of what we're seeing right now related to data. Where people are vaccinated, obviously the risk becomes much less, but even though we have a lot of people who have gotten that first dose, where you think about fully vaccinated 2 weeks post the second dose, it is still a relatively small number of people here in Chicago. So I'm still feeling very confident that a little later in the spring, this summer, we are absolutely going to be in a place, I'm feeling good about this, barring a new variant or some other real change here. But right now, with cases up to almost that 400 mark, the chances of there being someone with COVID who doesn't know it in a gathering, even a relatively small gathering, is quite high. And so this is what we're able to make the move on right now. So, I refer you to the website if you want to see some more details about that.
And outdoors does not mean no masks.
Outdoors definitely does not mean no mask. That's right, especially for gatherings.
It's important to emphasize that, right?
That's right.
So you may be going to church outdoors or have a special event outdoors, but you still have your masks on.
It's just that outdoors is our most natural way of having the best ventilation. And we know that people are wanting to gather. We're wanting to think about, what are the safest ways to do that. And clearly having things outdoors is one of the, from a harm reduction standpoint, it's absolutely one of the safer things to do. And so, as you are planning gatherings, if you're doing something personally, the best thing is it's just to have everybody vaccinated, right? If all the adults are fully vaccinated, you can be gathering in these small gatherings, without concern. It's when we're talking about these larger settings that trying to do everything they can to keep folks safe while we're in this in-between space, especially over these next few weeks. And we're going to see. I really want to be able to move ahead. We're well aware of these bridge plans that the state has put out. We want to be able to follow along. We want we're all about the reopening, but the state too has really said this is as long as the health metrics are stable. And right now there just are some concerns about that. So I feel like a lot of back to the dial a little bit. We're not turning anything back just yet, right? The goal is not to have to turn anything back, but it's also we're just not at a point based on all the things that we're following to do another big indoor reopening, right away this week. We're looking at it. I mean, we look at it every day, but every week we'll sort of be doing an update, and the goal will be to keep reopening. We've got to see what happens with some of the hospitalizations and some of the more severe outcomes, and that data is still looking good.
And it's worth saying that people really need to think about their bubbles.
Yes.
Right? We're not beyond thinking about our bubbles and, making decisions based on who's in our bubble and whom we need to protect.
Yeah. Yeah, that's right. And it's, vaccination is now sort of playing a part in there, right? So fully vaccinated 2 weeks post if everybody is, but if you've still got folks in your bubble, especially if they're older, especially if they have underlying conditions, they are still, at risk for COVID. And so who's gathering and what is that about is going to be a piece of the conversation. And maybe just before we get into questions, just one last thing is I do want to remind people that nothing has gone away in terms of the guidance around needing to stay home if you are sick, needing to get a COVID test if you are sick. That has not been dropped and it still applies. I had somebody say to me last week that, I think I just have a cold. And I'm like, no, right? We are not at a point, especially with numbers on the way up, that you should be assuming that you just have a cold. We need you still, and now especially with cases on the rise, if you've got new symptoms and you're not sure, you need to be home and you need to be getting tested. And there's a lot of testing capability across the city. But please don't be putting other folks potentially at risk and just assuming that sort of COVID is over in that respect too.
Yeah, that's a good reminder.
Yeah.
I think one of the very first
It was
orders.
the first. The first order, before stay at home, before anything, the very first order we did here in Chicago was basically the stay home if you're sick, even a little bit sick order. It had a more formal legal name to it, but it was that, and that, and that continues to apply, and we point employers to it. We've done sort of anti-retaliation things if employers are abiding by that. Employees, are abiding by that. But it very much remains in place. And it is, we talk a lot about the masking and the social distancing and the washing our hands, and we need to do that. But with cases on the rise, please don't assume if you're not feeling well, like it really could be COVID, and we need you to take that seriously.
All right. Cautionary words.
I know.
At the beginning that are warranted.
Yeah.
Okay, Donna Leonard from Facebook. Could it be a St. Patrick's Day partying fallout?
So I think we have definitely seen, young people gathering, including in situations like St. Patrick's Day, broadly driving some of this increase. As you know, we have actually very strict requirements in place here in Chicago for restaurants and bars, much stricter than much of Illinois, and certainly than a lot of the rest of the country. And so we do limit those spaces to no more than 50% capacity and a maximum of 50 people in any given room, and you've got to have the distance and the mask, all these things. But I think what we have seen, because my team investigates these, right? Especially where we're at a point where we are having a more manageable number of infections, our contact tracers continue to do this and call and do the investigations. And we've seen, I announced this at a press conference earlier in the week, but I think it was either 7 or 8 outbreaks just in these last few weeks among younger athletic teams. So we've seen high school sports, college sports, and adult, like recreational sports, all having outbreaks. And it was basketball, it was football, it was swimming, it was hockey, it was softball, maybe another. And some of these were pretty big outbreaks, 15, 20 people range. And the swimming, for example, itself, people are not generally it's not when they're swimming. It's the
gathering.
It's the gathering and the socializing. And, when we were working on this hockey outbreak, people meet in the bar afterwards. And, there's this sense of camaraderie, and we love camaraderie and we love sports. But when people are gathering.
And we haven't had it for so long.
We haven't had it for so long. And I'm not trying to sort of blame sports per se, but just reminding people, that when you're in settings and you've got, we've got those mask requirements for a reason, right? And that if you've got the mask on when you're playing the game, like don't just forget about the mask and do the socializing otherwise. And the other thing is we have seen, to the questioner, we've seen some outbreaks and some major clusters in younger people in some of the kind of university socializing settings, and some of those are at bars, right? Where people, it's not so much that they're meeting, they already knew each other, but they are gathering at the bar, if that makes sense.
Yes.
And large, lots of people. Again, we're talking 20-something people in some cases where we're seeing clustering, and it's just one person with COVID initially, but then people getting together, not wearing the mask, and not keeping their guard up. So I certainly think, we wouldn't pin it just on St. Patrick's Day, right? We had actually, I think, good adherence broadly across our establishments, but it is the relaxing of people feeling that they need to be as careful about COVID, and I think more broadly. But it's part of it, probably, yes.
All right. And then just timing-wise, then it means the next couple of weeks could be telling in terms of just the 14 days or so after.
Yeah.
And not only St. Patrick's Day, but March Madness.
Right. Exactly. Exactly. And I said at the press conference the other day, we were joking a little bit that, I know a lot of people here in Illinois were watching that Illinois-Loyola game. And
perhaps not alone at home like I was.
Perhaps not alone at home like you were, right? But seriously, we really highlighted, a little bit as a lighthearted way to remind people. But Sister Jean, 101 years old, chaplain for Loyola, she's at the game. She's fully vaccinated, 2 weeks past her second dose, and wearing her mask, right? Really doing the right things. And what we see over and over again is that where people are conscious of COVID and doing the right things, it's not where we tend to see the outbreaks. It's where people let their guard down, right? It's with people they know. It's in settings that they feel safe, and it's human nature. I get it, but it is concerning.
All right, Melissa Parrish from Facebook. COVID aftermath, day 28, and having many secondary symptoms. Research suggested to get one shot to help dissipate symptoms. Is this true?
Okay.
That would suggest that the vaccine has some medicinal purposes?
Yeah, I know what she's asking about. If I'm hearing this question right, you're 28 days post-COVID and you're still having symptoms, and I feel for you, and I feel for the many people who have had COVID. We have this term for it. We call it long COVID, where people have recovered in terms of, they're not in the hospital, they're not infectious anymore, they're not spreading COVID, but they continue to have symptoms. They continue to feel tired, they continue ringing in their ears. I mean, there's been a lot of studies, there's brain fog and joint pain, and there's actually a lot of work studying this kind of long COVID or post-COVID. And what she's referring to is that there have been just a couple of small studies and kind of anecdotal surveys that are suggesting that there are people who have had this sort of long COVID for sometimes a year, and then they get their COVID vaccine and it actually resolves some of their long COVID symptoms. I want to be really clear about a couple of things. We don't know the answer to this yet. This is, but I can tell you a little bit actually about why some of this is like. First, it was an anecdotal thing where patients were saying to my doctor, I've had this forever and I got the first vaccine and I'm feeling better, but it is not universal. There are plenty of people who have had the long COVID, not had that response. There were a couple of larger studies out of Britain that have been asking people, and there have been hundreds of people who have said, I had long COVID, I got vaccinated, I'm feeling better. There were also hundreds of people who just didn't answer the survey, right? So it's hard to know. I read there was one small study, again out of the UK, that actually did a comparison. People who had been hospitalized at least, I think, a year before. So hospitalized, sick, a long time ago, and had continued to have symptoms. And it was a pretty small study. Just, I think, 40-something people had gotten vaccinated against like 20-something that hadn't yet been vaccinated. But they were seeing a decrease in symptoms, about a 23% decrease in terms of some of the joint symptoms and whatnot. People who hadn't been vaccinated, sort of a 5% decrease over that same time period. So jury is very much out on this. I don't want to kind of emphasize that we know fully what's going on. But, I was talking to one of my friends who's an immunologist, and this, for people who are immunologists, this has been, of course, a fascinating time to have such a widespread outbreak and all the different ways that the immune system, it's been an opportunity to learn about immune response too. And, there's some theorizing that doing, you're in effect kind of giving your immune system a boost. You know what I mean? If you had COVID in the past, when you get the vaccine, yes, you are getting more protection, it's more predictable, but you are, it's kind of like this booster shot. And is that actually helping your immune system in some ways potentially clear some of those COVIDs? We don't know yet. But for me, it's sort of another good reason to get vaccinated, right? If you had COVID in the past, we strongly recommend.
And that question comes up a lot.
It does,
right?
it
Like,
does.
I've already had COVID. Should I get?
Should you get it? Yeah.
Yeah.
And we definitely recommend getting the vaccine, and for for a host of reasons that we've talked about. Everything from in these studies, it is a much more predictable. It's a dose, it's an immune response. We sort of know they've been studied against the variants, and we are seeing, not a lot, but we are seeing examples of people getting reinfected, getting COVID again. We don't want that to happen. And so, but this is another, kind of a newer thing. Too early to call it. And there will be some larger studies about this for sure. But we're still learning about the immune system and COVID, no doubt about it.
Yeah. So,
so for the questioner, I would recommend getting the vaccine. Assuming that your symptoms, you're no longer infectious, you're out of the hospital, your broad symptoms have resolved, you should get the COVID vaccine. And maybe you'll feel better and maybe you won't. I can't tell you on an individual level if that would happen, but the recommendation would be for you to get it.
And just a follow-up question, because I'm interested. So, would it be, it could be that your immune system has a boost, can fight it or whatever. Is that different from it really having medicinal impacts on?
Yeah, it's not really medicinal, right?
So it wouldn't be that.
It's not, because the vaccine, that's a good question. The vaccine is not treating COVID in any way. Like, let's be really clear about that. The vaccine is not, it's not like a medicine that treats COVID, which is why we don't give it to somebody when they have COVID right at that moment.
Yeah.
All the vaccine does is teach your immune system to fight off COVID. That is what a vaccine does. It teaches your immune system to recognize those little spikes on the COVID virus. And your own cells don't have those little spikes. And so one of the reasons the vaccine is very good is it doesn't attack you. Like, we get these questions sometimes, my autoimmune, this and this. It's just looking for spikes. And when it sees a coronavirus with those spikes come, it recognizes that your immune system already knows how to fight it off without letting it make you sick, without letting it get into your lungs, but it's not treating the COVID. So it really would be more the immune boost, if this turns out to be a thing, that is kind of helping you get over it. Because those long COVID symptoms are also not COVID per se, right? You're not still infectious. You're not still spreading COVID.
Right.
It's this long term. And these are, you think about chronic fatigue syndrome. You think about some of these like longer standing diseases that we still don't have great understanding of. Almost certainly, immunity plays some role in this. And, of the many things that will come out of COVID is probably better understandings of, our immune systems.
Yeah. Wow. Very fascinating. Okay. Evelyn Rivera from Facebook. I have both my vaccines. Is it okay to go get the shingles shot?
Yes, it is. So the recommendation is for the COVID vaccine, while it's under emergency use authorization right now, et cetera, we really don't want to give other vaccines at the same time. So we want a 14-day window on either side. So if you got your shingles vaccine, if you just got the shingles, we'll do it both ways. If you just got your shingles vaccine, wait 14 days to get the COVID vaccine. If you just got your COVID vaccines, wait 14 days to get your shingles vaccine. And that would be true. That's the recommendation really for all of the vaccines at this point. I actually expect that as these sort of come into more full authorization, probably it will be something that you would be able to get at the same time. It's not a live vaccine, neither is shingles. And so, it could be something, if, where there are still people needing to get vaccinated this fall, it could be, let's do the flu and the COVID together, maybe. Yeah. But right now, no. Just get the COVID vaccine. We don't want to kind of complicate that picture if you have side effects or anything else. So 14 days on either side. So you got your COVID vaccine, you got both doses. If it's been 14 days, get your shingles vaccine. And thank you for getting your shingles vaccine. We want everybody to get all their on-time vaccines, and shingles is not a disease, let me tell you, that anybody wants.
Yeah. Okay, Alana Haver from Facebook. So if you've been vaccinated, can you get COVID?
Okay, so if you have been vaccinated, you can get COVID. It does not happen very often, but let's layer that a little bit. The vaccine cannot give you COVID, first and foremost, okay? Just to be super clear about that part. Impossible for the vaccine to give you COVID. But the vaccine, even these very, very excellent, very protective vaccines, about 95% protective in the trials, right? 94, 95% for Pfizer and Moderna. And that means that in the trials, there's about a 1 in 20 chance that if you get exposed to COVID, you still could get COVID, even if you were fully vaccinated. The good news is that we see these vaccines, all three of them, Moderna, Pfizer, and J&J. We see all three of these vaccines amazingly protective against the severe outcomes of COVID. Right. Almost 100% protective against getting hospitalized or dying from COVID. But it is possible, it doesn't happen very often, but it is possible to get COVID. And that is part of why we continue recommending, while we still have a lot of COVID around, that when you're in public spaces, et cetera, you wear that mask. And if you are interacting with someone who has not yet been vaccinated and is at high risk, you should absolutely keep wearing that mask. And as our case numbers go down, right, as we really sort of get past COVID, the chance that you will be exposed to COVID will be even lower, and this won't be as much of a concern. But we call it a breakthrough case when we have examples of people who are fully vaccinated 2 weeks post, because that's the other thing. Some people say I'm vaccinated, but they've only gotten one of their doses, or they're not 2 weeks post. You're not fully protected at that point. And so definitely we see people getting COVID there. But we call it a breakthrough case if someone is fully vaccinated and yet they get COVID. And we have had cases of that, a few, in the range, last I was looking here in Chicago, 20 something among the, we've done 1.1 million vaccinations here in Chicago, and when I last looked at it, I think we had 23 examples of this. Most of those people were actually asymptomatic. They didn't have symptoms. We were testing them because they work in a hospital or they're at a long-term care facility. We continue to do a lot of testing in high-risk settings. Some of them did have some symptoms. Nobody has been hospitalized or died or gotten seriously ill, but it is a small piece of this, and I don't want people to freak out about this, right? The vaccine continues to work just as it is expected to work. And again, if everybody's vaccinated, not a big concern. But part of the reason you keep wearing your mask, please, in public or when you're gathering with people who are not vaccinated, is that there remains, a small chance that you could have COVID. And one of the differences here is that, I just said, just to kind of put this in the science perspective, that when you've been vaccinated, you've taught your immune system how to recognize that COVID virus and fight it off, right? Mm-hmm. So it'll keep COVID by and large from getting down into your lungs, which is when we really see people get sick from COVID. But COVID, if it, a little bit in your nose here, right? And it's sort of there for a little bit. Mm-hmm. We continue to see good evidence that these vaccines are protective against the potential of spreading COVID, but not 100%. And this is sort of comes along with this, right? You've got a few people who continue to get COVID if you test them, and it's a small piece of this. And I don't want people to take this, please, as a reason not to get vaccinated or think that the vaccines aren't working. They're working astonishingly well, but
and a much higher efficacy rate than the flu vaccine, right?
Much higher than the flu vaccine, because we have to make a flu vaccine every single year because of variants, and there's a lot more changes and all the rest of this. But these are amazing. Talking about protection rates that are in the 70 to 90% range is really, really good for a vaccine, and that paired with rapid and widespread vaccination in the setting of hopefully decreasing cases soon, will be great.
Taking a close look at those numbers.
That's right.
Yeah. Okay. John Speciale, or is it Speciale, from Facebook, saw a news article that J&J is coming in big numbers on Monday. Is this true?
Is this true? So we are seeing much more J&J. So let me do a quick update actually on vaccine supply, because that's probably people are interested as we move to 1C. So we'll take the J&J part first. About 3 weeks ago is when J&J got approved, and everybody across the country got a pretty nice initial bolus of J&J. We got about 23,000 doses of it, all in 1 week here in Chicago. And we use them to start our homebound program. We use them to do a lot of the strike team, bringing to some of the manufacturing settings for essential workers where we've seen outbreaks. We used it at O'Hare, where we had a lot of those 1B essential workers and wanted to get that vaccination done, and we gave some to providers. We then didn't really get any J&J for a couple of weeks here. We got just a little bit this last week, I think like 3,000 doses, not a lot. But this coming week, we're getting 15,700 Pfizer doses for the week, which is good, which is certainly much more than we've gotten for the last few weeks. It's still less than the Moderna or Pfizer that we're getting, just to be clear. And
so you said we're getting 15,000, you meant J&J.
Oh, sorry, what did I say? Thank you.
Yeah,
yes.
You said Pfizer. But
oh, apologies. Yes, I meant J&J. We're getting 15,700 J&J first doses this coming week. We're getting 26,500 Moderna first doses, and that has been flat. We've not seen an increase in Moderna in 2 months. Like, just it's been flat. And then our Pfizer did go up nicely too. We're getting 45,630 first doses of Pfizer, and that's up somewhere in the 8,000-ish range kind of for the week. And that's good because, you know, this week we had almost no increase. We got one more box of Pfizer. 1,100 doses of Pfizer was the only increase we saw to stretch across the entire city for the entire week in terms of first doses. Yeah. These are all first doses. And so, that's good. But the other thing is that pharmacies are getting vaccine directly. And so Walgreens in particular here in Chicago is getting about 17,000 doses of vaccine for this week directly from the federal government. Jewel is getting about 5,000 doses. And then now both Walmart and CVS are coming in the sort of 1,700 to 2,000 dose range. And so all of these, you know, we use vaccine as soon as it gets to Chicago, right? I mean, our efficacy numbers are fantastic here. Every single week, you know, we've set a goal, we've hit it every week of getting 95% of the vaccine that we get allocated out the door, 2 appointments, 2 providers, and then we set a second goal of all the vaccine, at least 85% of it, we want to see it in arms and reported within a week of delivery. We've hit that week after week after week, and in fact, we've been, I think last week we were at 94% of the vaccine was reported in arms within the week. And yes, that includes the United Center. And yes, that includes all these other efforts. Like, we are very good at getting vaccine into arms very quickly here. But the thing that has been holding us back is just that vaccine supply. So seeing more of it ramp up is good. We've got all the capacity in the world to handle vaccine. Hundreds of providers who we still have not yet been able to give vaccine to. So, you know, I feel good as we head into 1C on Monday, having seen that increase and hearing that it's going to keep going up. And you'll be hearing more about, you know, some plans for some additional, you know, larger mass vaccination type sites. And you'll be hearing much more about work with other community spaces and partners. And, you know, we've got it all planned out just as soon as we can see vaccine coming here. But yeah, there is some more J&J coming. And we would like to very soon be able to start making some of that available publicly, you know, at one of the larger mass vaccination sites or pods, for example. So a little more to come on that, but we're anticipating probably in the next couple of weeks, just as you've been able to, you know, get Pfizer when you sign up or, you know, whatnot. I'm very hopeful that J&J will be some of that, and we're going to keep using it for a lot of our essential workers and the strike team work where it really makes sense.
All right. Mary Beth KB from Facebook. Why is Chicago using the Community Vulnerability Index to decide which communities are hardest hit? Why not use actual people hospitalized and deaths by zip code?
Thank you for this question. So I love to talk about the Chicago COVID Vulnerability Index, because let me tell you, I think it is one of the best things, honestly, that we have done here in Chicago, and we get calls about it from all over the country. The Chicago COVID Vulnerability Index does include the things you're asking about. So let's talk about it for a hot second, okay?
You are like really excited about it.
Because it's like data, and you can go on the website and find out about it. But
there's a whole presentation on the website.
There's a whole presentation about it. But our EPI spent a lot of time working with a lot of community partners to say, let's be really thoughtful about what data do we have here in Chicago that is likely to be predictive of where in Chicago might we have more trouble vaccinating, and where have we seen harder hit by COVID. And so there's a lot of things in the COVID Vulnerability Index. There's things, you know, at the national level, they've used these social vulnerability indices, indices to include things like, you know, income levels and education levels, and, you know, things that more broadly we know will put different communities, you know, at more risk for things like not accessing vaccine. But we didn't just stop there here, right? We included a lot of Chicago-specific data. We looked at things like, where did we have crowded housing? Where did we have a lot of essential workers who couldn't stay stay home. And we looked at movement patterns to actually help inform that. We looked at where did we have a lot of people with underlying conditions and people who were 65 plus. And we looked at where in Chicago had we seen COVID cases, hospitalizations, and deaths. And we felt that it was important to include all of those outcomes because they haven't looked the same, and testing was different at different points. We ranked all 77 of Chicago's community areas, and we used that vulnerability index. During 1B, we used it for Protect Chicago Plus, first and foremost, where we've directed vaccine to the top 15 highest vulnerability index communities. But we've also used it as we've prioritized our strike team efforts and pushing vaccine to providers, and really doing what we can to lower risk factors. Where we know that there are a lot of people in a community who don't have a primary care provider and who don't have insurance, that's going to be a community that needs extra attention and extra work to get those folks vaccinated. So I think it was a really good, objective way. Of all of the data on COVID, my favorite graph is the one that shows that we have basically erased the inequities in COVID outcomes here in Chicago over these last couple of months. As a result of a lot of this is about the targeted vaccination efforts. So we now see COVID cases looking like Chicago. We see COVID hospitalizations and deaths almost looking like Chicago. And it is, that is good for everybody, because not having pockets of COVID spread is what in turn helps stop variants, helps keep this from happening. So yes, if you want to know more about the CCVI, check it out. But I have really liked it, and to be perfectly honest, we're getting a lot of calls from around the country. People very interested in how are we hitting both those good efficiency numbers and the good equity numbers, because it's really unusual for anybody to be doing a good job on both of these. And I can't thank, all of the partners and all of the medical providers and community-based organizations. This providers, we've built this enormous network. We've got more than 600 providers trained, ready, willing, and vaccinating, or wanting to vaccinate. In some cases, we haven't had enough vaccine to give them yet, and have worked really closely to bring vaccine, have focused efforts, and I am really proud of that work. And I, want to just thank everybody who's been part of that. But it's and a lot of it started from that index. It started from a database point, because there's the potential for a lot of politics to get into COVID vaccination. And we wanted to set really strict data-driven guidelines for prioritization and for decision making, particularly in phase 1B, when the vaccine is at its most limited point and the most essential to be able to get it into the places that have been driving our outbreak.
Yeah. Powerful stuff.
Yeah.
And I think people don't realize that the index has really contributed to layered strategies.
Yes.
It's not just Protect Chicago Plus.
No, not at all.
It's, how we think about appointments at the United Center. It's about how, providers who are in those communities
we
get
prioritize
allotment.
City employees who live in those particular zip codes. We thought about, really, we've tried to use this, and it's not about leaving anybody out. It's about making sure that we can have vaccination rates and best control disease in the settings that it's likely to be the hardest to control disease based on data. And so, it's really, there was a lot of folks, we're really happy about Protect Chicago Plus, and, you've done a ton on that. So thank you to, and all of your team there. But it is just about, even, we've gotten to all the senior facilities, or we will have, right? Yeah. 450 something of them, and they're all booked. They were all booked by the end of March. We learned about a few more, so now they're all getting done by April 10th. But yes, we are going to every senior facility in the city of Chicago and bringing vaccine. But where did we start? We started with the senior facilities in the hardest hit areas. It's that idea, right? It's not that you don't do everybody, but it's that you sort of do what you can to lower barriers in some of the communities that we just know based on data may be less likely to be vaccinated. And we've seen really good outcomes there, and more to come as we have more vaccine, more ability to bring vaccine to more neighborhoods. That's really what we want to do.
All right, speaking of seniors, Scott Cowan from Facebook, my 75-year-old aunt wants to get the vaccine in the neighborhood, Bridgeport, and she does not want to go to United Center. How do I convince her to get it wherever she can?
I love that question. And thank you for trying to convince her to get it wherever she can. We still are only about 52, 53% of Chicagoans over 65 have that first dose. I love every single one of our vaccine metrics, except that I wish we had more vaccine, except that one. We got to get more seniors vaccinated, because when we're seeing case rates doing this and we don't have high enough vaccination rates among seniors, I'm worried about it. So I would encourage her, first of all, appointments are available at the United Center, and you could go with her to the United Center. You can accompany her. You're welcome to do that. It doesn't mean you get a vaccine. That might be something we do down the line. When starting more people are eligible, more will come about that, but you could go with her. You can reassure her that if she has mobility issues, she does not have to walk far. We have wheelchairs. We have a whole area for people who don't want to walk. If there are language issues, we have on-site language translators. We have things for people who are hard of hearing or have difficulty with sight. We've done a lot of thinking about how to support folks, and it's very efficient. It's free. The parking's free if she's driving. There's lots of opportunities here, and we are moving people in and out. The whole thing is about a 30-minute experience. This is not like hours and hours of your life. Mm-hmm. So that would be one recommendation. The other thing is that, I'm glad she's at least interested, I hope. Maybe the United Center could be an excuse. I don't know your aunt. But continuing to encourage her, through her provider. That's still how most people over 65 have gotten vaccinated. And we still have been asking all of our healthcare providers, please, please, please. And that includes pharmacies, that includes primary care, that includes hospitals. Please keep prioritizing those over 65, even as you continue to prioritize those with the underlying conditions at highest risk. So have her check in with her doctor. Increasingly, whoever her doctor is going to have vaccine, and that would be another option for her closer to home.
All right. Well, thanks for working on that,
yes.
Scott. And anybody
One
else?
ant at a time.
Yes, that's right. That's right. That's right. We're going to get there.
Yeah.
All right. Well, it looks like we are
are we at time already?
Time
Okay.
for good news.
Time for good news. One piece of good news I did just want to mention, and it's a little bit connected to this, how am I finding vaccine? And broadly speaking, of course, as we move into 1C, the good news is that we are going to continue to use ZocDoc.com/vaccine. As more and more vaccine becomes available, there will be more appointments. There is not going to be appointments for everybody on March 29th. Let me be really clear about that. There will be appointments, though, over April and May. Just like in 1B, everybody couldn't get it right at the end of January, but we've pretty much made it available to most eligible people working hard in February and March. But ZocDoc.com/vaccine. I wanted to just highlight, I've been hearing this like there's never appointments on ZocDoc, and so I actually had the team run this morning. At the United Center alone, we've booked 37,313 appointments on ZocDoc. We've been posting every day some appointments, and yes, we have continued to give prioritization to certain zip codes, to this other point, but those are open to anybody in Chicago, and anything on ZocDoc is open to anybody, in Chicago who is eligible. Starting on Monday, that'll be anybody with the underlying conditions and any frontline essential worker. So you're probably going to be frustrated when you're trying to find a vaccine on March 29th. Let me just set that. But as we move into April and May, there will be opportunities. And can I just take a quick detour? Because I didn't. Please, 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 if you make an appointment for 2 or 3 weeks from now, and then you get a vaccine somewhere else, can you please cancel that other appointment? Because we're having a lot of problems with people who made a lot of appointments, right? Maybe they were worried, they didn't trust they would actually have an appointment. They put their eggs in many baskets, and we're actually backing up. Like when we opened at the United Center, we opened up about 3 weeks of appointments all at one time. Well, we've seen a lot of no-shows because a lot of those people that were used to get to the end of those 3 weeks. And so we're going to be not doing quite as much of that ahead time booking. But I don't want you, the vaccine's going to go up, it's going to go out. I promise you're going to be able to get a vaccine in April or May if you're eligible, okay?
Open up your golden ticket if you found a way to get it done.
But we're also going to, the other thing is, so ZocDocs are going to be your place to look. There's going to continue to be community-focused work, and providers are going to continue to get vaccine. A reminder, if and pharmacies, that's part of why I listed those out, they are getting additional vaccine. Unfortunately, because the pharmacies are national chains, they're not really connected to the vaccine finders in the ways that I wish they were. And that's not just here in Chicago, that's across the whole country. So when you go to our website, chi.gov/COVIDvax, you'll see the websites for those different pharmacies. And those are also going to be good places for you to check if you're looking online. Our call center will remain open. Again, there's just not going to be enough right at the beginning for everybody. And so, I would actually recommend, if you're willing to, wait a week or two, and it will be a less frustrating experience probably. But we are excited about opening up. But I did where we started in terms of the good news, but I just did a little detour there. Was that in a community-focused way, there are opportunities, and nobody brought it up, but one of the questions we've been asked a lot about is how are you supporting Austin with having to, not be giving Loretto Hospital first doses right now. And so I just wanted to highlight that Rush is picking up some of the work that Loretto had been doing in Austin right now, and thanks to them for doing that. And so for people who live in Austin only, who live in Austin only.
You're an Austinite.
You're an Austinite, and you have to be an Austinite. This is part of the Protect Chicago Plus work is we look really closely at addresses, and we really keep it. Rush.edu/Austin or 312-563-0767. That's rush.edu/Austin or 312-563-0767. And that is for some of the community events, on the weekends, et cetera, that are in Austin only for Austin residents. Other than that, our general call center has not changed. If you know a senior still who hasn't gotten vaccinated, please have them call now. We want to get them in.
And our home. You were going to do a number?
312-746-4835. I know it by heart. I sure do.
I didn't expect you to say the phone number.
I know it by heart. 312-746-4835. We've got 200 people who started as contact tracers and are now supporting this. And then our homebound.
I was just going to say,
yes.
We have a homebound program for seniors who cannot travel outside their house to get that vaccine. And you can get that information on the website at chi.gov/COVIDvax, VAX.
Yep.
And there's a form there that you can fill out, and the homebound program brings the vaccine to the household and vaccinates other people who live or take care of that person.
Let me just add a slight piece on that, is that it's not the fastest way to get a vaccine. So it is, we're excited about it, we're really committed to it, but a very productive team of, 2 people vaccinating house to house is going to vaccinate, 10 people, 12 people in a day kind of thing. And so we expect this program to take really through the whole summer to get through. And so if you live with someone who is homebound, we want to make sure you get vaccinated. The risk to the person is really about the people who they live with coming in. But yes, do sign up on there, and we'll be following up. But don't expect it to happen tomorrow, and don't be worried if it hasn't happened yet, because this is going to be continuing likely all summer.
All right.
I think that's the good news. 1C begins Monday. That is really good news. I'm a little worried from a vaccine supply versus demand perspective, but the fact that we are opening to, the great majority of Chicago adults in the end of March is amazing. Like where we think about where we were a year ago, and the progress we're making continues to be very good. More vaccine here. Will be more vaccine in arms. We are not doing Facebook Live this coming Tuesday, but we will be back a week from today. April 1st at 11 a.m. And there will certainly be other announcements and things coming next week.
So we'll be back on April Fool's Day.
We'll be back on April Fool's Day. We will.
So in the meantime, protect Chicago. Protect yourself, protect your family, protect your community by doing all the things that we know we must continue to do. Do not assume that you're walking amongst vaccinated people, because we're not at that point yet. So please wear your mask, watch your distance. Wash your hands, and if you're not feeling well, stay home.
There you go. I like bringing some of that old school messaging back. Thanks everybody for tuning in. We'll see you next week.